Puerto Rico Medical Board style clinical vignettes. Topic: acid-base disorders, identifying types of acidosis and alkalosis. Vignette 1, high anion gap metabolic acidosis. A 35-year-old woman is brought to the emergency department after being found unconscious. She has a history of type 1 diabetes and has missed her last few insulin doses. On examination, she has deep rapid respirations and fruity breath odor. Labs: pH 7.23, PCO2 22 mm per gram, HCO3 10 mg per liter, Na- 140 ml per liter, Cl 100 ml per math, glucose 480 mg per dl. What is the most likely acid-base disturbance? A. Normal anion gap metabolic acidosis. B. High anion gap metabolic acidosis. C. Respiratory alkalosis. D. Metabolic alkalosis. Correct answer B. High anion gap metabolic acidosis. Explanation: this is classic diabetic ketoacidosis, DKA. The low pH and low HCO3 mins point to metabolic acidosis. The anion gap equals Na minus Cl mins plus HCO3 mins equals 140, 100 plus us 30. It's elevated. Vignette 2, normal anion gap, metabolic acidosis. A 54-year-old man with a history of chronic diarrhea presents with fatigue and muscle weakness. Labs: pH 7.31, HCO 16 mg per d, PCO2 31 ml per gram, Na 137, Cl mins 105, K 3.4. What is the acid-base disturbance? A. Respiratory alkalosis. B. Metabolic acidosis with elevated anion gap. C. Metabolic acidosis with normal anion gap. D. Metabolic alkalosis. Correct answer C. Metabolic acidosis with normal anion gap. Explanation: diarrhea causes loss of bicarbonate, leading to a normal anion gap, hyperchloremic metabolic acidosis. Vignette 3. Metabolic alkalosis. A 40-year-old woman presents with muscle cramps. She has been self-treating her acid reflux with excessive use of baking soda. Labs: pH 7.49, HCO3 32 mg per liter, PCO2 46 ml gram, Na 138, K 3.1. What is the acid-base disorder? A. Metabolic alkalosis. B. Respiratory alkalosis. C. Respiratory acidosis. D. Mixed. Correct answer A. Metabolic alkalosis. Explanation: elevated pH and bicarbonate suggests metabolic alkalosis. Hypokalemia supports this, and baking soda sodium bicarbonate is the cause. Vignette 4, respiratory acidosis. A 60-year-old man with COPD presents with drowsiness and confusion. Labs: so pH 7.8, PO2 60 mm H gram and 26 micrograms. What is the acid-base disturbance? B. Metabolic acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. Correct answer A. Respiratory acidosis. Explanation: COPD leads to CO2 retention. Elevated CO2 with low pH equals respiratory acidosis. Vignette 5. Respiratory alkalosis. A 23-year-old woman presents to the ER with lightheadedness, tingling in her hands, and palpitations after a stressful event. She is breathing rapidly. Labs: pH 7.52, PCO2 26 mm per gram, HCO3 22 mm. What is the acid-base disorder? A. Metabolic acidosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. D. Respiratory alkalosis. Explanation: panic attack, hyperventilation, CO2 drop, high pH, respiratory alkalosis. Do you want a summary table?